I'm Dr Ian Strawford, and I'm the Medical Director of Skin Excellence Clinics. Are you a male who's suffering with erectile dysfunction or impotence? It's very common and not often talked about. Are you also maybe suffering with painful erections due to a condition called Peyronie's disease? Anything that's affecting your sexual function? This may be something that we can help you with the P-shot. If you've not heard about the P-shot and how it can help erectile dysfunction and problems associated with that, then follow and listen to this video and I'll tell you more about how the P-shot works and how it can help you with your erection problems.
What is the P-shot?
So the P-shot is a treatment for erectile dysfunction and other conditions like Peyronie's disease that was developed by Dr. Charles Runnels in the US. It's a treatment we've been doing at Skin Excellence Clinics for quite a number of years now, having been trained by Dr. Runnels himself in the procedure. This treatment is using your blood, okay? It's using something called PRP, which stands for platelet-rich plasma. Simply, we're taking your blood and we're extracting a high concentration of the platelet cells. Now, these are cells within the blood that have growth factors and regenerative proteins and coding mechanisms within these little cells that help the body repair. And so this is our body's rejuvenating repair mechanism. And we're effectively isolating and identifying those platelet cells and stimulating them to release those growth factors and injecting them directly into the penis, into the area where we want it to regenerate. When we look at why men get erectile dysfunction, it's quite complex, but it does involve the aging process affecting the blood supply and the nerve supply to the penis. And so by rejuvenating the nerves and the blood supply, we can improve and restore erections. And so we're reversing those changes. And that's what makes the P-shot such an effective, natural, regenerative treatment for erectile dysfunction.
How can the P-shot help men?
So the P-shot is harnessing the regenerative capacity and the healing capacity of our body, and we're specifically using it to help men who are suffering with erectile dysfunction. They may or may not be suffering from a condition called Peyronie's disease, which it can also help. This is an inflammatory condition of the corpus cavernosum, or the sponge of the penis, which initially causes very painful erections and then leads to subsequent scarring of that sponge within the penis, causing a distortion of erections, often with a bend of the penis when it's erect, and that can really quite significantly affect sexual function. So it helps those two conditions, either just erectile dysfunction, which many men suffer with later in life and from middle age, often associated with other medical conditions and medications, but it can also help with the painful condition of Peyronie's disease itself.
Is the P-shot painful?
So the P-shot procedure involves taking your blood, processing the blood to get very, very high quantities of PRP, and then injecting that PRP back into the penis. Now, those injections into the penis can be extremely painful. But at Skin Excellence Clinics, I inject a local anesthetic into the base of the penis, which is called a penile block. It blocks the nerves to the penis. So it makes it a pain-free procedure when we're injecting the PRP. Similar to going to the dentist. If you have dental treatment, you often have a local anesthetic to block the nerves so that you don't feel the pain of the dental treatment. So we can make it a painless procedure.
How many P-shots will I need?
The number of P-shots men require is variable. We need to identify the cause or the potential causes of one's erectile dysfunction, for example. And in simple cases, where there are no major medical factors causing that erectile dysfunction, it's just part of the aging process, then usually between 1 and 3 P-shot procedures are needed. We do a P-shot procedure and we evaluate 1 to 2 months later whether that is having an effect and decide whether we're going to do further P-shot procedures. When we're dealing with a condition such as Peyronie's disease, where we're trying to change scar tissue within the penis, then often men need more than 2 or 3 P-shot procedures to achieve that. But then that is a permanent result once we've improved the Peyronie's disease. In the case of Peyronie's disease, the earlier we start having the treatment, i.e. in the stage where one is getting painful erections, then the more effective that treatment will be. And it may be that they need only 1 or 2 P-shot procedures to reverse the initial changes of Peyronie's disease and halt it in its tracks.
What happens after my P-shot?
Part of the P-shot procedure, so on the day you will have a P-shot procedure, you will leave the clinic and everything will be working. The anesthesia will wear off after an hour or 2 and the sensation within the penis is normal and there will be normal functioning of the penis. There will be no problems with regard to urination or even the ability to get erections. One of the important parts of the P-shot procedure is the aftercare of using a penile vacuum pump. And this is very important because a penile vacuum pump will forcibly bring blood into the penis, and that as if one is having an erection. And we need to do that after the P-shot because the P-shot, we're injecting growth factors into the penis. Those growth factors have to work through something called stem cells, and it's the stem cells that repair the tissue. Stem cells are present in blood. So when we are bringing more blood into the penis, i.e. when it's erect or when we're using a vacuum pump, we are bringing more stem cells into the area. So the more stem cells there are, the more effective the growth factors will have an effect from the P-shot. So we aim to get men using a vacuum pump, which they've usually accessed themselves before they come for the procedure, and they're using it 2 or 3 times a day, if possible, for the first few weeks after the P-shot procedure. And that's an important part of the procedure. Without the use of the vacuum pump, then the P-shot itself will be much less effective.
Is the P-shot guaranteed to help me?
A lot of people ask, is the P-shot a guaranteed treatment that's going to work for me? So what I can say is there is good evidence that the P-shot works for the vast majority of men suffering with erectile dysfunction. And however, if there are certain medical conditions such as long-term diabetes or trauma-related nerve damage, then those nerves may be past the point, or the vasculature, their blood supply may be past the point where any reversal of that is possible. So in some patients who have significant medical conditions or are on a lot of medication that actually can interfere with erectile dysfunction or create erectile dysfunction, then the treatment may be less effective. In my experience, it's a rule of thirds. About 1/3 of men get an excellent full recovery even after 1 or 2 treatments. 1/3 of men having P-shots will get some significant improvement, and that may mean that they're less likely to need to use other medication like Viagra, but it's not perfect, but it's significantly better. And unfortunately, about 1/3 of men, it really doesn't make a lot of difference. And in those men, they usually are the ones, as I said, who have quite significant medical pathology. Maybe they've had a radical prostate surgery for cancer, which damages the nerves, or they have severe diabetes or something like that. So most men who are fit and healthy and active usually respond very well to the P-shot.
Why come to Skin Excellence clinics to have the P-shot?
So the P-shot, only doctors and medical clinics who have been trained appropriately in the P-shot procedure and are using the equipment to guarantee the quality of the PRP that we're injecting can offer the P-shot and advertise the P-shot. We have to be licensed by the American Medical Cellular Association, who do our training with regards to the P-shot. And so only licensed providers around the world, and that includes the UK, are allowed to advertise and perform the P-shot. So you need to check, if you're going to have a P-shot, that your provider or your doctor is one of those regulated licensed providers, because otherwise you may not be getting the treatment as it should be. And that's obviously would be as a concern from both a safety point of view, but also from the point of view of the effectiveness of the treatment you're going to have.